from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Welcome back into Good Morning Arkansas, everyone. So February actually kicks off the American Heart Association's Heart Awareness Month, and that's highlighted by Go Red for Women. So this morning we're joined by Dr. Morgan Sauer of Baptist Health. Dr. Sauer, I want to ask you, is there a specific focus, or why is there a specific focus on Go Red for Women this February?
Heart disease is the #1 killer in the United States. Some people think it's cancer. Some people think it's Alzheimer's disease. It's actually cardiovascular disease that is the #1 killer. So it's important to highlight that. What's especially important to highlight is heart disease in women. Heart disease is the #1 killer for both men and women. The problem is in our health system, women don't have as good of outcomes as men do with cardiac disease, both in terms of prevention as well as how do they do afterwards. And so it's important to really address these disparities, hit them head on, highlight them, and let's do something about it.
Yeah, a tough conversation to have, but definitely a necessary one as we continue to move forward. So what are some of those signs and symptoms of heart attacks and stroke, and how can they maybe be different for women specifically?
A lot of people think that stroke and heart attack are going to be the same for everybody, and it's not. So obviously in heart attacks, chest pain, crushing, feels like an elephant sitting on your chest with shortness of breath, and I try and get up and do something and it really hurts. However, in women, there are a lot more diverse symptoms. So pain may radiate into the jaw. It can do it in men, but in women, you're going to have more what we call atypical symptoms, atypical from a man point, and that's jaw pain, radiation of pain to the arms. Some women describe a feeling of a tight sensation and a squeezing sensation in the back, nausea, vomiting, and unexplained fatigue that's just kind of onset. One cardiologist in Austin, Texas described it as, I ran a marathon, but I didn't move an inch. How did this happen to me?
Interesting.
In terms of stroke, a lot of patients have changes in their speech, changes in movement, changes in balance. But in women, it can be, again, prolonged excessive fatigue, new onset headache that has never been there before and unexplained, and also nausea and vomiting.
Right. So we see that there are a bunch of different symptoms, but this kind of brings me to the question of what are silent heart attacks?
So silent heart attacks kind of have two different components to them. One component is it really is a heart attack that had no symptoms whatsoever. The aftermath of that, later down the road, people may feel fatigued, may not have as much energy as they used to have, because part of the heart tissue got damaged and the heart doesn't work as well as a consequence of that heart attack. You can especially see silent heart attacks in diabetics. Then there's the other category that we say is a silent heart attack, and that's just where we don't recognize the symptoms well enough. Indigestion type symptoms, again, the squeezing and the shoulder type symptoms, the symptoms that are more common for women to have, and that's why we need to be a better focus on those.
So I do want to ask Dr. Sauer, what else should we be aware of in terms of going red for women this February, and really at all points?
I think the really incredible, powerful message that needs to be sent out by Go Red for Women is that women are different than men. Their heart function and their cardiac modeling with Olympic athletes, we know, is different from an incredible study that's coming out of Italy. And so we need to appreciate the difference. The other thing is we need to listen to women. Sit down, take a good history and physical. It doesn't mean we need to go do a whole ton of tests on women because they're a woman. It's just we need to be more aware and more vigilant, and women need to take more power over their health care and speak up for themselves and say, look, we need to look into this a little bit more. I'm really not feeling well. 100 years ago, we talked about histrionics in women, and that really has set a tone in the mindset of America. Additionally, we know that women and men, when studied about CPR, women are less likely to get CPR as compared to men, and less likely to survive CPR as compared to men, because both men and women in the study were concerned about sexual assault. So we need to really think about what we're doing, bring it more to the front of our minds instead of hiding it in the back of our minds, and do a good job for everybody.
A really awesome thing to hear from you this morning, Dr. Sauer. Thanks so much for coming on and sharing that information with us. And hey, Going Red for Women, of course, people can, be a part of that as well, literally wearing red, right? But if they want to learn more, or if there are viewers at home, Dr. Sauer, who want to take that leap to take their health into their own hands, where can they do that? Where can they get more information from you?
One of the best places to get information is going to the Baptist Health website. Additionally, you can gain more information from the American Heart Association at goredforwomen.org.
All right, good stuff this morning. Thanks again for coming on with that.